For those of you who don't know me, I'm Dr. David Lawler. I'm a dentist in town, but I do not have a traditional practice of dentistry as you know it. I instead limit my practice to the management of chronic head and neck pain, temporomandibular joint pain, which you all know as TMJ, and sleep-related breathing disorders called obstructive sleep apnea, or a little known thing called upper airway resistance syndrome. You might think that that is kind of an odd combination of things to focus on, the pain management part and the sleep-related breathing disorder part. It's my goal that before the end of this evening has gone by, you'll understand very clearly how those two things are literally hand in glove and work together very closely. I'm here tonight with Dr. Stephen Windley, the Director of Integrative Medicine at Sheck Medical Center in Seymour. Together, we're here to talk about some very chronic conditions, chronic pain, chronic fatigue, that have been really resistant to help with conventional medical approaches, but by working together, we've had an enormous amount of success in helping people have more pain-free and more energetic lives. I really wish that I had some way of conveying to you adequately what Dr. Windley's patients say to me about him, without embarrassing him. Maybe I should step out of the room. Yeah, they talk about his amazing listening skills, his ability to sit back and just really almost let them tell him what's wrong, and so he can move from there. They talk about his reluctance to prescribe medication to deal with symptoms, but rather his insistence on getting to what's causing the problem in the first place. I am routinely amazed at the geographic range from which he draws patients. I know of a patient at Seymour, he's from Seymour, which is about an hour and 15 minutes to the east. Someone I know of comes from him from at least an hour and a half to the west, do the math. Somebody I know was a patient of his, southern Indiana near the Ohio River, someone close to Indianapolis, so he's got an amazing large geographic draw. And you stop and think that when somebody from that distance goes to him, they're literally driving past hundreds of other medical providers on their way to him. And that's for a reason. So without causing him to blush any further, I'd really like to introduce to you my friend and colleague, Dr. Stephen Windley. And
I do appreciate being here tonight with Dr. Lawler. It has really been quite a fun partnership for me since he and I have been working together. He has been wonderful as a mentor for me, learning and studying this very unique perspective on both sleep and pain, and it has really been an education for me. Again, my name is Steve Windley, and I am located in Seymour, Indiana. I am medical director of the Integrative Medicine program there. I've been there for approximately 7 years, and it's really been a lot of fun and a great source of satisfaction for me. The hospital's been very supportive of this program and the patient base, which draws really from all over the state, as well as Kentucky and Tennessee and Illinois and Ohio and Michigan has really been supportive as well, and we're grateful for that. This is one of my favorite quotes from one of our brilliant thinkers, Thomas Edison. Doctor of the future will give no medicine, but will interest his or her patients in the care, or his patients in the care of the human frame and a proper diet and cause and prevention of disease. Someday maybe that'll happen, right? Someday. So from my perspective, what we're looking at are a lot, it comes down to these factors: diet, fitness, sleep, and we're really going to talk, especially Dr. Lawler is going to talk about that. Again, I don't want to bore you too much because I want you to be wide awake for that, because he's really got some cool stuff. Hormone balance, which is one of my favorite areas, digestive health, and then detoxification. Diet, I always talk on first because it's most important, and it's the thing that I can't control for the patient. I certainly want to educate them, but it's up to the patient, and it is so important. The most successful people really take care of the diet, really go after the diet, and that's where we see a lot of gains. We try to make this a top priority, and again, the ones who succeed do. They really listen to their bodies and see what they can learn in terms of improving their diet as part of their prescription. Food is fuel. Food is a lot of things. Food is comfort, food is celebration, food is social, but food is fuel. And we need to keep that in mind because that is where our body gets our fuel. It's from food. And when we make our main source of food, main source of fuel, that is McDonald's and White Castle and heaven forbid what else, we really have to ask ourselves, is that the type of fuel that we want going into our bodies? So what does the body want? And it is very, very simple. It would probably be easier to enlighten people if it were a little harder, but it's not. It's simple. It's vegetables, fruit, protein, and you can throw in nuts. For all of us, in varying ratios, that is what the body wants. Vegetables, fruit, protein, and nuts. That's what we survive on. That's what the body knows how to use and utilize very effectively, very efficiently. This is what will keep the metabolism in line, keep our immune system, our health, and so on. All revolves around this. Everything else is extra. If we walked into a grocery store right now and we went through the fruit and vegetable, the produce, and then we went back and went through the protein, maybe stop by and grab some almonds or walnuts, we'd be done. Everything else is extra. The 90+% in the grocery store is all extra. We don't have to have it to function. In fact, we will function optimally without most of that stuff. That is what the body wants. I went too quick. There's a book that I really like on the last slide called The Paleo Solution. And my wife just happened to pick that up here in town when Borders went out of business, and she said, hey, you might like this. And I loved it. I think it's a great book. He really goes through a lot of the myths surrounding food, surrounding fat, surrounding sugar intake, and where a lot of our problems lie currently in the diet. It's what we're eating, and really how our food pyramid has gotten so off track, and what we need to do, and in a nice, understandable form, goes through how certain foods affect our appetite. For example, when we eat protein, which is meat, fish, chicken, turkey, eggs, there's a signal that our brain gets saying, hey, we've eaten protein, we are satisfied. Calm the hunger down. When we eat fat, we also get a very similar signal. If we all split a birthday cake the size of this room, we would not get that signal. Our brain still feels hungry. That's why carbs get us into trouble. Carbohydrates, that is sugars, that is. Because we remain hungry, plus we don't get the nourishment, the nutrition that we need. I throw this slide as one of my favorites because it's so important. Again, in terms of the prescription for optimal health, pulling yourself out of the hole, whether it be chronic fatigue, fibromyalgia, chronic pain, whatever the issue is, you have to have the food prescription in place. And we know at least, at a minimum, we need 5 servings of fruits and vegetables a day. You really start to see some decrease in cancer risk. You start to see decrease in heart disease risk. And it's not a big surprise that our country's medical bill becomes $2.3 trillion when we know something as simple as getting 5 servings of fruits and vegetables a day, and less than a quarter of our population does that consistently. Almost over a decade span that they followed it, we don't, only 25%, less than 25% get 5 servings of fruits and vegetables a day, which really should be a minimum. The troublemakers, again, we want to include these two because these are really what has gotten us to that $2.3 trillion bill. High fructose corn syrup, partially hydrogenated oils. You see those a lot in processed foods. You see these, the high fructose corn syrup is a very cheap but very troublemaking sweetener that's found in just about everything. Soft drinks, jellies, candy bars. Partially hydrogenated oils are found in certain things like potato chips. There are certain types of peanut butter that increase shelf life, but don't really increase our life. the pesticides, food colorings, all of these things, these are not food. These are not, absolutely not fuel. We need to wrap our minds around the idea of food as fuel. We need to wrap our minds around the concept that food is part of what is going to help us feel optimally. Okay, we can't skip that. We are really, I had a patient tell me she was digging her grave with her fork. And this was right after she had had a colon surgery because she had so many problems related to her weight. Diabetes is thought to be going to be affecting 1 in 3 adults in the very near future. We are already at $2.3 trillion, and we've already really surpassed what we can afford. What happens when diabetes is 1 in 3? There are so many financial tidbits you could throw in terms of our healthcare system. I just threw in what healthcare bills are, I think, the leading cause of personal bankruptcy. Sugar I always hit on because it's just that important. Insulin is a hormone in our bodies that we use to control blood sugar, and it's necessary. We have to have that to live. So it's part of our system. However, as we eat more and more sugar, as we increase our sugar intake, the need for insulin gets higher and higher and higher. As we increase the insulin needed to take care of the sugar, we increase something in the body called inflammation. And inflammation you can envision in a number of ways. It's kind of like the hot coals in a campfire that you may have in your joints, in the arthritis, in the heart disease process, in a cancer process, in dementia or Alzheimer's. Those are all types, chronic conditions from inflammation. And sugar is a big trigger for that. As I mentioned here, when patients take control of their diet, they begin to feel more control of their symptoms, more control of what has been controlling them, more in control of the quality of life that they're so eager to get back. And the ones that really don't buy into it really kind of, the process is much, much longer, typically much more expensive, much less satisfying to them, versus the ones who really can say, hey, I get it. What I have been eating is making a difference. What I'm going to be eating is going to make a big difference. I throw this out because it's a big part of what we see in chronic illness. Gluten. Gluten is a protein found in these grains. And it is something that for the digestive tract, many people cannot break down. Many people cannot digest gluten adequately. And when it is absorbed into the system, it sets off a lot of triggers, a lot of inflammatory markers that affect the body in a whole host of ways. And it used to be thought that maybe 1 in 10,000 people had a problem with gluten. Now we're thinking in some cases 1 in 33 people have problems with gluten. Many symptoms, constipation, diarrhea, bloating, indigestion in terms of bowel issues. But that's not where it stops. It can really affect people head to toe, headaches, sinus issues, brain fog, arthritis, fatigue. One of the cases that I have in the clinic is the gal who had migraine headaches really for almost a decade. And her headache issue was a daily thing for her, just getting through the day with that. And they are gone on a gluten-free diet. And she just, at first she just couldn't believe it, and it changed her life. I have a patient who says, as long as I don't eat gluten, she's in her 60s, as long as I don't eat gluten, I don't have my arthritis pain. Several people who have chronic sinus issues, when they come in, we get them on a gluten-free diet, and they'll see a big difference. The sinus infections decrease, the immune system seems to strengthen up. We've had numerous people on with thyroid difficulties that have responded to a gluten-free diet. One of the other things that gluten does, when it's bothering your digestive tract, it's also blocking in some of the other good things that you're eating from being absorbed. So minerals like zinc or iron, calcium, magnesium aren't going to come in as well when your body does not tolerate the gluten. Now I will say that gluten affects everybody differently. In an ideal setting, we wouldn't eat gluten. I think everybody would be better off, but certainly some people are extremely sensitive to it. And so we do throw this out. In fact, the sicker the patient is when they come into the office, the more likely we're going to talk to them about this, and the more likely, honestly, that they're going to see a difference. It's very common. So when we do talk to people about that, we try to get them on a 2 to 4 week gluten-free diet. The longer they do it, the better, but if they can at least try it, if we can at least have them buy into a 2-week trial, see how they feel, and see how their symptoms do. And a lot of times they may or may not notice a difference. We have them, all right, go ahead and re-challenge the gluten, try it and see how you feel. Then they notice the bloating, then they notice the indigestion, the brain fog, the fatigue, the joint aches, the sinuses flare up, the headaches. And so we really try to hit on gluten pretty hard. Let's keep going. Let's dive in. This is my son here in the with the long skinny legs there on second to the left. Hormone balance is really one of my favorites. This is an area we work on every single day with most patients, and where a lot of my study and time goes into the past several years. In hormones, there are several throughout the body. Thyroid, some of these you may have heard about. Thyroid, your adrenal glands, which men and women both have. Blood sugar involves a hormone, insulin. We talked about testosterone and several others. I really enjoy working with hormones because it's a way to help a person regain some strength, regain some stamina, regain some life back fairly quickly. Hormones have pronounced effects. All of these hormones affect dozens, if not hundreds or more things in the body. And so when you get a hormone back in balance, a person can start to see a difference and really feel hope that they're going to make some progress. They can help with inflammation, help with pain, and energy boosting, as I mentioned. A lot of people, when they get their hormones balanced, they feel they get their memory back or their mental stamina back. The brain fog is lifted that they struggled with at school or at home or at work. Very important for sleep, especially quality of sleep. And they're frequently depleted when you're dealing with a chronic condition, such as chronic pain, chronic stress, chronic fatigue. And again, it's so fun because it's rewarding for both the patient and me. We look at this, we talk to them. The history is most important. We take an exam. For example, you can kind of look at thyroid just by looking at the reflexes of the patient. Blood work, depending on what test we're doing, we do a lot of saliva testing for hormones as well. Thyroid symptoms, for example, and this is a big one because a lot of people present with these symptoms. A lot of people have had maybe some thyroid testing done, but maybe it wasn't very specific. Maybe the lab was old and they were told they were fine, and the new standards on the lab testing, for example, have changed. But cold hands, cold feet, constipation, fatigue, people who get cold easily, say in a room like this, they have to wear a couple jackets versus the person who's in a t-shirt, muscle weakness, loss of muscle stamina, thinning of the eyebrows, especially the lateral third of the eyebrows, brain fog or poor memory, not being able to keep up at work or keep track of things like they used to. These symptoms are pretty common. Progesterone is another one we work on frequently, mainly in ladies. Hot flashes, night sweats, poor sleep. A lot of times when patients say, do I need estrogen with hot flashes and night sweats? A lot of times it's not the estrogen so much as it is the progesterone. It's interesting to note that as progesterone declines in females, their breast cancer goes up. Joint aches, mood swings, very common. We had a lady who was 65 in a couple months ago in terrible pain. She really had lost a lot of her quality of life, and it was basically a progesterone deficiency. As we got her progesterone corrected, she's doing great. DHEA and testosterone for both men and women. Men have more DHEA and testosterone, but it's found in both men and women. Fatigue, libido, muscle mass, joint aches, brain fog. You could also include inflammation on that. We had some patients in today who had some chronic joint pain that are improved with DHEA treatment. Also can benefit blood sugar balance too. So hormone support, one of the big ones we work on is one called the adrenal gland. And you may not hear a lot about that. Sometimes it pops up in the news or what have you. Adrenal gland sits on top of your kidneys, and it's really just a small little gland. And it's interesting, in Chinese medicine, they really knew that the kidney adrenal gland was kind of the heart of our energy, the seat of our energy, if you will. And they placed a lot of importance on that energy axis, on that area. And it really is true. The adrenal gland is our fight or flight, it's our stress organ, it's our energy, it's our get up and go organ. We also work on nutrients for the thyroid, sometimes thyroid treatment if indicated. Testosterone, as an example for men, could also be for women too. And then trying to get people to cut back on the sugar. Sugar just gets you in every direction. Not only does it raise your blood sugar and risk diabetes, it can actually deplete your good hormones that you need to keep in balance. The next category we work on, again in a chronic health issue, is the digestive tract. And there are many reasons for that. Part of it is as you are suffering from a chronic condition and enough stress is put on the body, the digestive tract usually falls too, usually gets involved. And that is critical because aside from oxygen, and you could say water, all your other nutrition, all the other mechanisms that are needed for the body to repair itself come in through the digestive tract. So if your digestive tract starts to fail, now you've lost your repair ability to improve the chronic pain and so on. Many medications, for example, that the patients come in on. I had a patient come in the other day, and he's a real nice gentleman. He's not feeling well. I asked him to count his medications. He was on 14 different medicines, and he's certainly not the leader in that category, but that's a lot. That's a lot of potential drug interactions. We have no way of knowing if those interact or not. We can guess and we can hope, but no way for sure. We look at bloating, constipation, indigestion, heartburn, loose bowels. These are all signs that the body is not absorbing nutrients the way it should. Okay? Bloating means food is not being digested. Indigestion or heartburn typically means food is sitting in the stomach, not being digested. Those people usually are not getting in their iron or their B12 or their zinc as well as they need to be. Loose bowels, food goes right through me. I'm in the bathroom right after I eat. Those people are not absorbing their nutrients. They're not getting the food, even if they're trying to eat healthier, they're not getting paid for what they're doing. The food is going right out of them. Frequent antibiotics for ear infection, sinus infection, sore throat. Those can destroy the good bacteria in the body, which we rely on to keep our bowel walls healthy. Probiotics, which is basically what we lose with antibiotics. And that's not to say that antibiotics are always bad. Sometimes they're very much indicated. But it's very important that we restore these good bacteria. You may not have known that we have a lot of good bacteria. In fact, the good bacteria in our body outnumber our own cells. Some people say even 10 to 1. And they are there to do several functions for us. They keep our bowel walls healthy. They help make vitamins for us. They have been shown to improve our immune system. For example, people who take probiotics during the winter actually have fewer respiratory infections. And we need them for healthy thyroid as well as immune function. Things we do for digestive health, probiotics. Sometimes we use digestive enzymes to help break down food. The last 4 are just examples of things to help improve the integrity, the lining of the digestive tract so that we can better absorb nutrients, so that we can block out bad infections, so that we can help our immune system. 2/3 to 3/4 of your immune system lines your digestive tract. When we eat something that doesn't agree with us, such as gluten, or when our digestive tract is just irritated, it's kind of like taking 2/3 of our army and pointing them in the wrong direction. So that's very important when it comes to chronic illness. Supplements that we think about, there's a whole host of supplements. We have some great health food stores here in Bloomington, and you could spend days in there learning about supplements. Some of the ones we focus on, anti-inflammatory, vitamin D, turmeric, boswellia is actually frankincense. They knew a long time ago it had very, very potent powers in terms of health. And boswellia and turmeric is found in curry. It's the entire Indian food, and they are looked at now very closely for anti-inflammatory properties for treatment for pain. Turmeric, in fact, is being looked at a lot in cancer as well. We also do a lot with what we call essential fatty acids, which are healthy fats the body has to have, and those come from fish, from flax, from avocados, from coconut, almonds, walnuts, healthy fats, grass-fed beef, for example, that the body needs to have. Those are anti-inflammatory fats. Energy support can come, there's a lot of different things that could fit on this slide, but some of the most common ones, B complex vitamins are very easy. Vitamin C is very easy to do. A couple that I like here towards the bottom, CoQ10 is another one that we use a lot for headaches, for muscle spasms, tight muscles, even for high blood pressure, as well as kidney failure. One of the nice things about nutritional supplementation is we're very fortunate. I think part of it is because these are all things found in the body anyway. There's a very nice safety range. The body tolerates them well. Very few, if any, side effects. They don't always work overnight, although sometimes we get lucky that way, but they are very well tolerated. And then again, try to stress fitness. Now, that's not always easy when people are fighting fatigue or pain, but we do want to keep them moving as best they are able. I stress yoga a lot to my patients. My wife is a yoga instructor. She's extremely flexible and can do neat things, and I am not. I'm terribly inflexible, and it's funny when she tries to teach me things. That being said, it's not difficult to do what you can do, and you do what you are able, and it's a great technique not only for the fitness side, but for the de-stress side. Stress, of course, is one of our biggest obstacles, and it is really part of any chronic disease. A lot of times it is the cause of the chronic illness, whether it's a relationship stress, a job stress, family stress, poor sleep, loved ones, health habits, what have you. Stress really has to be addressed as best we can, and a lot of times when the stress is removed, the chronic problem is removed. One of the things that stress does, a lot of times when people go to the doctor or even just talking it over with a friend, they're told, you know, you're stressed, maybe you need an antidepressant, oh, it's all in your head. And really stress is a real phenomenon. It raises a hormone in the body called cortisol. And to have a little bit of stress is something the body can deal with. In fact, if teenagers don't have stress, they complain about being bored all the time. But for us, when we have stress day after day after day, it raises our level of cortisol. And this is a problem if it goes on and on and on, because it will actually suppress our immune system. It will lead to a weakening and eventually just the destruction of the inner lining of the digestive tract. Our energy will be depleted, our ability for our body to repair itself will be compromised, and one of the big things that cortisol does is it prepares us for our fight or flight response. Well, if your body's in fight or flight mode, if it's thinking from the neck down, hey, I better be ready to fight a lion or a bear outside in the hall, it's not going to be ready to go into a deep quality sleep. So elevated cortisol, or the fight or flight response, is not going to let deep sleep happen. And one of the things that I've learned from Dr. Lawler is how much takes place when we have deep quality sleep and how much we miss when we don't have it. One of the things that we commonly see in many of the patients who he has worked on is as they get deep quality sleep, their metabolism improves. I had a lady in a week or two ago, she's lost 22 pounds, really doing the same thing she's always been doing. She's just sleeping. She's finally getting deep quality sleep. And it's part of the prescription, just like diet is, just like fitness as best we can, we have to find ways to work with stress. Fortunately, hormone balance helps. Fortunately, better diet will help. Working with the sleep as best we can. What he's going to talk to you about in terms of the oral systemic balance has been magical in many cases. And exercise is a big stress reliever. Hobby, counseling, yoga, honestly, sometimes it's just whatever tool we can get the patient to investigate for stress. It's just got to be part of the prescription. These are some of the treatments that we use. One of the things we do like to know is we check levels with the cortisol, because it's quite common for a person to be flip-flop. Normally cortisol is highest in the morning when we wake up and lowest at night. And we have many people who are too high at night, too low in the morning. They want to be a night owl. They say, hey, you know, the nighttime's the only time I have energy to get things done. And in the morning, they're way too tired to get up and get out of bed. And their body's gotten flip-flopped, and we have to get them back on track. And these are some of the things that we use to do that. This is I'm going to touch on this briefly because really we have an expert in the room tonight, so it's a lot of fun, but it has really been an education for me, learning a whole new aspect of sleep. And in medical school, we're taught about sleep, and we all know it firsthand. If we don't get a good night's sleep, how tired or foggy we can feel the next day. But the thing that I would like to stress and maybe reiterate a little further is just how important deep sleep is, how important deep quality sleep is to the body's repair mechanism. There's plenty of research to show if the body does not hit deep quality sleep, our inflammation goes up. And inflammation, we know, is linked to heart disease, it's linked to cancer, it's linked to just chronic aches and pains. So when we do not hit deep quality sleep day after day, month after month, in some cases decade after decade, we put our body in position for more and more inflammation. And one of the things that I've seen in working with him is just how common sleep issues are, how common issues like sleep apnea is. I mean, we have just no idea how many people, it's a daily thing. I have probably 3 people today with sleep apnea. Gonna be busy, but it's very, very common, and it's not. We unfortunately for many years did not have the tools to address it, but we really have learned through his work how important sleep is. Some of the things that we do in addition, just to help the body prepare for sleep. I tell patients, sleep in a cave. You know, get the lights off. If you have light coming in from a security light or street light outside, try to get shades up, try to get a towel up, something to darken out the room. Put the cell phones in the kitchen. Try to limit the electromagnetic frequencies in the room. The body wants to sleep. It wants to repair itself. It wants the outside world to leave it alone while it can go repair all the damage we did to it that day. Now, just a couple things on detoxification, since it's kind of the last category we talk about, and just to quickly stress on these things before we turn it over. This is a study I always like to bring up just to raise awareness. A group did a study on 10 subjects. What they did was they took a blood sample from each of these 10 subjects, and they basically looked for 417 different chemicals, all of which were foreign to the body. Chemicals like DDT and other things, some of which have been banned for 20 or 30 years, and tested to see how many people had certain chemicals in the body. On average, they had about 200 per sample, foreign chemicals, again, foreign to the body. 287 total were detected. And as the stats say, there are 180 known to cause cancer, toxic to the brain, birth defects, and so on. The fascinating part, if that's not fascinating enough, the fascinating part of this study is that these samples were from cord blood. What does that mean? These samples that average 200 chemicals per sample were taken from newborn babies. Okay? These babies were being born with 200 different chemicals in the body. If that's not incentive enough to start working on your diet and working on fitness and working on sleep, I mean, it starts from birth. We've got to get this process going. We unfortunately are only moved farther and farther behind the 8 ball, so to speak, in terms of keeping ourselves healthy. It's only getting harder. These 200 chemicals didn't even exist 100 years ago that our body now faces. The liver, kidneys, bowels do this every day. It's part of the natural process. The liver is a detoxifying organ. That's what it's made to do. We've got it. That's why constipation is such a problem, because that's how the liver and the bowels eliminate toxins. Water is extremely important to the detoxification process, as are vegetables. One of the things that broccoli, cauliflower, or Brussels sprouts, you can pick your favorite. You don't have to eat all three. Not a big Brussels sprouts guy, but I like broccoli and cauliflower. They are very important in terms of the detoxification of the liver and cancer prevention. Asparagus, the same, and garlic too. Limit pesticide intake. I always try to. I had a guy in today. We think he's probably having some difficulty from the chemicals he works around at work. Please be careful with what you use in your home, especially what you use in closed spaces. Artificial sweeteners always bring up the fact that one of my favorite uses of aspartame or NutraSweet is to put it in a small bowl with some water, and we've used it to kill ants around the house. So I'll just leave it at that. The Dirty Dozen, the same group that did the 10 study, called the Environmental Working Group, puts this out every year. And these are the Dirty Dozen. These are the foods highest in pesticides, which doesn't mean don't eat them. It means try to get them organically or locally when you can. Apples and celery, strawberries. Apples in particular are very high in pesticides, and I'd recommend you try to get organic. And some people ask, do I always have to buy organic? You don't always have to, but you want to try to as best you can, as best you can find, as best your budget allows for these foods. And you can get this list if you just Google Environmental Working Group, and you can get on their email, and they'll email you a new list every year. They also put side by side the Clean 15. These are the ones that are very low in pesticides, and so you're still welcome to get these organically when you can, but you don't have to. You want to focus your healthcare dollar on the Dirty Dozen. So we put this all together. We talked about a game plan. Talk to your family in terms of how you want to eat to help get yourself motivated and stay on track. Talk to your doctor about your symptoms you're having. And we do try and get patients to take an inventory, what really is your diet. When I read that book, The Paleo Solution, I had been gluten-free for almost 2 years, but I still realized there were gaps in my diet that I could improve on. Your sleep schedule, do you even allow enough time for sleep? I had a guy who's finding kind of a tough situation. He only allows himself 5 hours of sleep at night, and that's just not going to do it. I mean, he's not going to be healthy with that little amount of sleep, and exercise too. And then we try to really get people to focus on goals, where they want to be, and seeing themselves being healthy. A lot of people have been sick for a long time. It's hard to stay motivated. It's hard to wake up with the same symptoms every day and really see that you're going to get better. And that's tough for them. It's tough for the doctor or the healthcare team. And we really have to get them convinced that yes, we can do it. We can do it together. But we've got to get your mind focused on where it wants to go. I just put this in just to say, again, how exciting it is to be here. We have sent several patients, in fact, some of our toughest patients, to Dr. Lawler, and he is doing this therapy, this oral systemic balance that he's going to talk to you about a little bit. He called me up one day. We had never even met at that point. He had worked on a few patients of mine, and he said, I was just calling to say that I'm doing this new therapy I wanted to tell you about called OSB, and I was immediately delighted. I had heard his mentor speak at a conference, I think in 2004, and it was out in California. And we go to these conferences a lot and hear about therapies in California and New York, and you think, well, that's never going to come to Indiana, and you kind of tuck it away and forget about it. But it really was exciting. In fact, I saw it in the newsletter a few months later, and I thought, again, that would be so neat for us to utilize, but it's hard to make a referral for a patient to go out to Washington State for something that they aren't familiar with. So when he called me up and told me he was doing it, it was just fantastic. And I was really excited. The first really 2 patients he treated for me, it really was divine intervention because the first case was just magical. The results we got, I just never would have predicted. And the gentleman is doing so well. It's just silly. He had a neurologic condition, and it has responded so well, really MS, and I just couldn't believe it. And that really set the stage to get me motivated on this. I bought into it at that point. It was an easy sell at that point. The second patient he treated really had a lot of chronic pain, had been dealing with it for years, and it just turned it off. And it's, we just see this time and time again. He treated a young gal for us, and I had her back for follow-up last week, and really I was worried about it. I didn't think we had much else to offer. I honestly thought mentally she was not going to get over the hump with her illness, and she came back in and hopped on the table, just smiling ear to ear, and said, "I'm doing great." And it's just been awesome. It's just been amazing, and I can't really do it justice other than to say it's just about as excited as I have been. It's about as excited as patients have been, to know that there's still hope, there's still an option. A lot of the stuff that I've shown you, we've been doing for a long time, and some people you can really turn them around, and then some people you can help them to a degree, but they hit that plateau. And this oral systemic balance has just opened a whole new world. It basically, for us, has allowed so much more to work better, and for many patients has just brought them life again. So I can't overstate the therapy. I can't overstate how exciting it is. There's nobody in Tennessee that I'm aware of who does this. Nobody in Kentucky who does this. Maybe a few people in Ohio. I'm not sure of anybody in the southern part of Illinois who does it. I'm not aware of Michigan. I mean, to have this, it really, in my backyard for patients, I'm just tickled. And I've told him there's absolutely no question of retirement in his future. That is done. So guys, I want to thank you for your time. Finish with one of my favorite quotes. I think it's very important. It's not, I'm nonpartisan here, just saying. People let the government decide what foods they eat and what medicines they take. Their bodies will soon be in the sorry state as the souls who live under tyranny. That was Thomas Jefferson a couple hundred years ago. So let's keep that in mind. My son and daughter right there, we're wrapping things up. So thank you very much. And I'm going to turn it over to Dr. Lawler, and we'll certainly be available for questions at the end.